As the nation grapples with yet another unsettling rise in COVID-19 cases, a closer look at the data reveals some alarming trends. But here's the part that might catch you off guard. The virus isn't just creeping back. It's surging in specific regions of the US, leaving experts concerned about what this means for the coming months. According to recent findings shared by the Centers for Disease Control and Prevention, CDC, certain states are experiencing particularly sharp increases in infections. A cluster of states in the southern part of the country, Arkansas, Louisiana, New Mexico, Oklahoma, and Texas, are seeing roughly 15% of their reported COVID tests come back positive. That's a significant uptick, signaling widespread transmission within these communities. But it doesn't stop there. The western states aren't faring much better, with over a dozen states west of the Mississippi River showing positivity rates hovering around 10% last week. Now here's where things get tricky, and potentially misleading. Many people are relying on at-home testing kits, rather than heading to labs or clinics for official tests. This shift has likely resulted in an undercount of actual cases nationwide. So while the numbers may seem daunting, they might only scratch the surface of the true scale of the outbreak. To get a clearer picture, scientists have turned to a somewhat unconventional method: analyzing wastewater. Yes, it sounds unpleasant, but tracking sewage can provide early warnings about rising infection levels in a community, even before people start showing symptoms or seeking medical care. Wastewater monitoring is proving especially valuable because it picks up both symptomatic and asymptomatic cases. And according to the CDC, several states are currently showing very high viral activity based on this type of surveillance. Alaska, Hawaii, Nevada, Texas, and Utah top the list. However, even this approach has its limitations. Some states lack sufficient testing infrastructure, meaning not all areas contribute reliable data to national efforts. So why does this keep happening? Why do we see these summer spikes year after year? If you've been paying attention since the pandemic began, you've probably noticed a pattern. Epidemiologists suggest that one reason could be our behavior during warmer months. People tend to congregate indoors more often when temperatures soar outside, retreating to air-conditioned spaces that often lack proper ventilation. These conditions create ideal environments for the virus to thrive. Add to that the increased travel and social gatherings typical of summertime, and it's no wonder cases spike. Another factor worth considering is immunity, or rather, the waning of it. Dr. Ziad Al-Ali, a senior epidemiologist at Washington University in St. Louis, explained to the New York Times that protection from booster shots administered in the fall may begin to fade by summer. For many, this leaves them more vulnerable to infection as the months pass. Yet access to vaccines remains inconsistent. In a controversial move, the Food and Drug Administration recently approved updated versions of Pfizer, Moderna, and Novavax vaccines, but primarily for seniors. Younger adults and children without underlying health risks now face stricter eligibility criteria, raising concerns about equity and public health preparedness. And this is the part most people miss. How accessible will these vaccines be this fall and winter? Will insurance plans cover them fully? These questions remain unanswered as a CDC advisory panel prepares to meet in September to discuss next steps. With colder weather approaching, the stakes couldn't be higher. But let's pause for a moment and ask ourselves, are we doing enough to stay ahead of this recurring issue? Or are we stuck in a cycle of complacency until the next wave hits? Share your thoughts below. Do you think current measures are sufficient? Or should we rethink our strategy entirely?